Ready?
Hi, my name is Jenny, and today we're going to be talking about enemas and as well as performing a urinary catheter insertion. So I'm going to begin by explaining some details about the enemas. So as far as the types of enemas, there is the cleansing, retention, and return flow enemas, and each require the patient to be in SIMS position on their left side. So the cleansing enema uses a tubing which is placed on an IV pole. Once the solution is inserted into the rectum, the patient is to hold on to the solution for as long as they can until the bedpan is placed underneath them. In the fluid retention flow enemas, it uses tubing as well and an open container which is held on an IV pole. The solution is placed into the container which flows into the rectum, and then once the solution is instilled in the patient, the container is lowered so that the solution inside of the patient's rectum flows back into the container. Whenever we insert any tubing for the patient, we always make sure that they are in the SIMS position on the left side. We use any water-based lubricant for comfort. So prior to beginning any procedure, we would first need to perform hand hygiene for at least 15 to 20 seconds. Then for the fluid retention, for the return flow enemas, we would require to don PPE equipment, so a gown. We would need to confirm the patient's identity, and we would also need to ensure their privacy. Whenever we are, before we begin the procedure, it is always best to explain to the patient the steps of the procedure, and at any time that they feel any discomfort to let us know so that we can stop and pause the procedure if needed. We would also need to confirm any allergies that the patient has and confirm the physician's order. Okay, so for the urinary catheter procedure, we would again identify using two identifiers, confirm the patient's identity, perform hand hygiene for at least 15 to 20 seconds, and as well introduce ourselves to the patient. So the packaging includes a sticker where we can put our initials and the date of the insertion. Okay. We would always need to prepare our equipment before starting the procedure. For the catheter insertion, it would need to be a sterile environment. So we would open the packaging as much as we can without contaminating the field. So the first thing that we would need to do is instruct the patient to lay down in a supine position, and then bending their knees so that we can begin by cleansing the patient's genital area using the iodine. So this packaging already brings gloves, which I guess we would use as sterile. The drape. So I'm going to use these as just regular. Okay, so once we open the catheter packaging, there is a drape that would be used for under the patient. So then prior to putting on our sterile gloves, we would grab a corner of this drape and we would open it in a way that we don't contaminate any other area. Okay. And then this would be, I guess, our patient for today. Okay, so we would place the pad underneath the patient. Okay. Then we would put on our sterile gloves. these are a pair that I have used before. Okay. So then the next step would be to use the fenestrated drape, which we would place over the patient's genitalia. Okay. And then using the iodine swabs, using our non-dominant hand, we would spread the labia and we would wipe in one direction. We would discard. We would use another one. Okay, so prior to inserting the tube, we should prepare the lubricant, which a little opening right here. Okay. We would, at this point, prepare the catheter, okay? Using the solution to inflate the bag, we would prepare it. We'll prepare that in a second. Okay. So we would dip the tip of the tube into the lubricant, and then using our non-dominant hand, we would spread the labia, and we would insert the Foley into our make-believe urinary system. And there we go. Okay, and we would insert it until we see a flash of urine. Okay, and once we see the flash of urine, we would at that point, we are supposed to be using, this is a little technical, not being a patient, but we would hold the catheter in place to make sure that it does not come out, and then we would inflate the tube. Which you can see happening in here for purposes, I don't know if you can see the tube. Okay. So once we do that, we can notice that the urine is going into the bag. Yay! That's pretty neat. Okay. And then we can confirm here that we see the liquid going into the urinary bag. And that's that.